My name is Denis Xavier. I'm from St. John's Medical College in Bangalore, India, and I'm the principal investigator of the Center of Excellence in Bangalore. From our center in Bangalore, we collaborate with 3 other institutions in India with whom we've been working for a long time. Our developed country partner is McMaster University in Canada. Chronic disease is making a very important impact on the life in India as such. The rates of chronic disease, particularly heart disease and diabetes as such, are rising at an alarming rate. It's going to have very bad effects. To counter this chronic disease in India, we are conducting what is known as knowledge translational research. We're not doing research on any new drug or any new device, but we are trying to find out what are the best strategies with which we can implement what we already know to counter chronic disease. There are 3 projects that we are conducting. One is in primary prevention. That means for individuals who have a risk factor or individuals who have a higher chance of getting heart disease or a stroke, we are trying to identify them and trying to reduce their chances of getting a heart attack or a stroke. So this is called primary prevention. The name of the study is PREPARE, and we're doing this in 3 village regions of India. The second study we are doing is called SPREAD. This is what we call a secondary prevention study. Secondary prevention means for individuals who already have a heart attack, we are trying to ensure that their chance of getting another heart attack is reduced. That means we're going to identify these individuals as they are being discharged from hospital, and we're going to have non-medical health workers who will follow them up when they go back home, and also make a visit to their house to ensure that they are taking the medications that they are supposed to take, also making regular visits to the hospital. So in both our studies, we are using community health workers or non-physician health workers who will be in touch with the patients and ensure that their chances of getting another heart attack or a stroke is that much more reduced. The third project that we are doing is a large study in strokes. We have very little data on strokes from India. We had completed a big study in heart attacks, but we don't have much information about strokes. So we're going to identify about 75 to 100 hospitals around the country, and then we are systematically studying which are the patients that are getting a stroke, why are they getting strokes, what are the causes for their stroke, and once they get to hospital, how are they being treated in hospital, and what their outcomes are in hospital, and when they go back home at 1 month and also at 6 months. And thereby making a detailed analysis of these 10,000 plus patients, we can identify which are the patients who are doing well, which are the patients who are not doing well. And by studying this carefully, we can make recommendations and identify how to treat our patients better. Okay, once we get these studies done, we will have very important information to find out in an Indian context for Indian people, given the socio-cultural situation, what works and what does not work. And when we know what works, we can firstly educate our patients, we can educate even the doctors who are treating them. Very, very importantly, we can make recommendations to the government. We can tell them, here, listen, this is how we need to follow up and care for our patients so that they do not get an event, they do not suffer complications. This important information will be very useful for us to scale up and expand to different other parts of the country, so that overall in a relatively short time, not 30, 40 years, but maybe even 10 years, we can begin to make a difference to reduce heart disease and strokes in the country as such. Okay, one important way in which to ensure that whatever we are doing continues for a long time is to identify young doctors as well as other research support personnel and train them and also motivate them to do work in similar areas. So firstly, we are identifying young doctors who are very enthusiastic and even bright, and we're going to train them for 2 years. This is known as mentorship-based training. And we're going to match them up with an accomplished researcher within the country or in Canada, and then through them help them to conduct good quality research projects over 2 years. We're also providing them funding, we're providing them infrastructure, IT support, etc. And in this 2 years period, we'll also have intensive workshops for 2 weeks each. So we are creating a group of young people who, in the short term, maybe let's say in 3 to 5 years, will be able to conduct similar projects in their own places and systematically address the issue of chronic disease so that something substantial can be done for the country. Our long-term hope, firstly, is to ensure that we have lots of young people who identify chronic disease as an important area and start working not only on research projects to generate evidence, in other words, to find out what works and what does not work, but also to engage with different stakeholders. Now, stakeholders means with the government, with the patients, with caregivers, maybe with food industry, with different people. So people with multiple skills, people who are passionate about chronic disease, and they in turn work systematically to reduce the burden of chronic, particularly cardiovascular disease in the country as such.